Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And today we're going to have knowledge and information relative to something that you've been writing us about. You know, the top 3 issues that come up to us all the time are cancer, heart disease, and minimally invasive techniques. Well, we're going to get an answer to 2 of those, I think. So let me first introduce Ryan Sobel, the medical director of the Head and Neck Robotic Surgery at Broward Health here in Broward County. Welcome, doctor.
Thank you for having us.
And we also have Pia Delvaille, who is an A.R.N.P, which is Advanced Registered Nurse Practitioner, and she's the Regional Manager for Cancer Services at Broward Health. Welcome, Pia.
Thank you. Thanks for having us.
We're glad to have you. You know, Dr. Sobel, let me get to you because like I said, the number 1 issues that come to us, and we've been doing these programs now for well over 20 years. I think this is the 518th show. But constantly, the 3 main issues over the last 5 to 8 years have been cancer, heart disease, and minimally invasive techniques. So I think you can talk a bit about it because the robotic surgery issue is a big, big issue with our viewers. So Dr. Sobel, it's all yours. Tell me about your head and neck robotic surgery unit.
Head and neck cancers in general are a diverse group of disorders. Some of them are treated with surgery, some treated with non-surgical means. The surgical approaches historically have been very dramatic. They require very large surgical exposures and leave the patient with a great deal of side effects and complications in some cases to have to manage over time. So what we've noticed in understanding more about the disease processes is that we're able to adequately treat these in surgical cases with a much less aggressive approach and preserve a lot of function. So when we say minimally invasive approaches, we're not meaning that we're doing less to try to avoid doing the correct surgery. What we're really saying is that we're approaching this in a way that we're trying to optimize oncologic results while minimizing any functional deficits for the patient. Robotic surgery is one of those approaches. And we're able to use the Da Vinci robotic surgical system to access tumors of the back of the throat. This allows us to avoid very large incisions and cosmetic deformities for patients while still adequately treating the tumor.
Well, you know, again, when these folks are talking about minimally invasive, they are really talking about, in their minds, less cutting, less bleeding, and less pain. That's the commentary that usually comes from the viewers. And it's been like that, I would say, for the last 8 or 10 years. These have been the 3 top subjects. So when you explain robotic surgery and using the Da Vinci, you're explaining to them how you mitigate the pain, the destruction of the structures, and the ability to be more whole and be valuable to the rest of their lives because of the work that you've done, correct?
That's correct. So one of the main indications that we use robotic surgery for is for an HPV or human papillomavirus related throat cancer. And that typically affects patients across all socioeconomic boundaries. So these are patients who may otherwise be completely healthy, who suddenly are arriving at a diagnosis of cancer and require treatment for it. These healthy patients will have effects from their treatment. If we can do anything to mitigate those effects in the long term, it'll significantly impact their quality of life. And robotic surgery allows us to adequately treat the patient's cancer while minimizing their functional deficits from a swallowing and cosmetic approach. It also reduces postoperative pain. It reduces hospital stay, which also cuts costs from a medical standpoint and from a patient standpoint as well. It's less of a burden on insurances and is more widely available to everyone in need.
You know, The Da Vinci unit, I guess, is in one of those collaborative ORs, correct?
It's in our main general operating room.
Right. But there's always, you have the ability of having colleagues that are in other areas who would work with you. There's the availability and the opportunity to utilize that particular collaborative unit, correct?
We are blessed to be in a level 1 trauma center to have a great deal of subspecialty input as needed. So in treating head and neck cancers in general, prior to getting to the operating room, our patients are evaluated by our head and neck multidisciplinary team. And that is something that is a known really requirement for treating almost any type of cancer, and particularly for head and neck, it's extremely important. There are a lot of effects on the patient that they may not realize when it comes to daily activities such as swallowing, speaking, even social interactions when we're able to do that eventually. It significantly impacts their quality of life. And a multidisciplinary team doesn't just have physician providers in treating the cancer like head and neck surgeons, radiation doctors, or chemo doctors. It also has rehabilitation specialists. And for head and neck cancer patients, they're getting swallowing evaluations from our speech and language pathologists. They're getting specialized oncology nursing care who are experts in treating head and neck cancer patients, social work, as well as nutrition and dietitian resources. So all of these providers come together to give a very well-rounded multidisciplinary treatment plan.
Well, that leads us right to Pia Delvaille, who is the Regional Manager of Cancer Services. So, Ms. Delvaille, you're on.
One of the things that we are very proud of here is what Dr. Sobel mentioned is our multidisciplinary team approach to caring for the patients that have head and neck cancer. Our oncology infusion center is all staffed with oncology certified nurses. We have the radiation department that again is staffed with radiation specialist nursing staff. And we also are just proud of the fact that we have our team here from the nutritionist, the speech therapist, and all of the rehab specialists that are involved in the patient's care. We know that having all of these people on board caring for the patient leads to better outcomes for the patient.
Well, you know, I always say that the greatest weapon that a patient has, and to tell you the truth, the well-educated professionals that both you and Dr. Sobel are, is knowledge. And knowledge is brought forth through the collaborative and, shall I say, complete cancer services that you're relating to. Because cancer in itself, beyond just head and neck cancer, but other cancer-related issues, as you mentioned the various elements, at least some of them, at Broward Health, there is that responsibility to communicate not only with the patient, but the patient's family, because there's an ongoing need for knowledge, correct?
Correct. And that's one of the great things about having the specialized team is each person can, each member of the team can reach out to the patient and their family members with special education, whether it comes to the nutritional services, whether it comes to how to help with their rehabilitation in generalized cancers, as well as head and neck. We find that, yes, I mentioned that we have better outcomes, but also with having the multidisciplinary team, we are able to enhance the patient and family member satisfaction.
I applaud the collaborative nature of the cancer services that are at Broward Health. Dr. Sobel, let me ask you a question. Do you get many issues referred to you by dental practitioners relative to what they see and what they send off to the various labs for review?
One of the most common referral sources we see are from both general dentistry and oral maxillofacial surgery. These are providers that are routinely looking in the mouth and doing a very thorough evaluation. In some cases, they're able to perform biopsies in the office. When they're not, even if they see something suspicious, we would very commonly get a referral from them to evaluate the patient and make sure that everything is okay. If there is something suspicious, we're able to take a deeper look with our in-office endoscopy and scopes, as well as even perform biopsies while the patient is in the office that day to arrive at a diagnosis. Hopefully it's not a cancer, but there are certainly other benign tumors and other things that we can deal with. Very common.
Yeah, the reason I guess you're aware of the fact that our oral maxillofacial surgery unit is across the street from you, immediately attendant to the main building. Dr. Coltman, of course, is renowned in not only this area but around the country, and he's now the interim dean at the College of Dental Medicine. So we see so many issues that come through our dental clinics because we have 100 unit patient care clinic. So I just wondered whether you got to see much of that, and I'm sure you do.
Yeah, so it's actually a great example of the collaborative nature that you really need to have in treating head and neck cancers. So we work very closely with not only our dental colleagues in both a pre-treatment and post-treatment aspect, but also during treatment, the OMFS department and their colleagues who are at Broward Health with us will actually participate as part of our multidisciplinary team. So we certainly aid each other and have a very collegial relationship. You can't really do head and neck cancer treatment in a vacuum, and it requires treatment from all aspects. Oral maxillofacial surgeons are great at helping patients achieve functional outcomes in terms of dentistry. They're also integral in the pre-treatment aspect in identifying these cancers on the first line.
And of course, they're intimately involved with the fact that you're a level 1 trauma center.
So one of the things I also wanted to mention here is that your clinic also participates in our head and neck conference that is held weekly, and that's where the whole multidisciplinary team comes together and they discuss from when the screening was done, the diagnosis, and the whole treatment plan, before surgery, after surgery, what chemo and radiation is needed, and everybody is there giving their input into the care, and your clinic is your OMFS clinic is a part of that too.
If I might, because we have this also came as a question from our viewers. As you know, I always say this program really is the viewer's program. I just sit here and try to, moderate their questions and try to get people like yourselves that are the experts to try to give them answers. I noticed that there seems to be a lot of interest in radiation versus non-radiation. Have there been a number of conversations, I'm sure, in cancer services at Broward Health?
Historically, and this is back in the 70s, 80s, beginnings of the 90s, head and neck cancer was treated primarily with surgery. And as I mentioned previously, it was really with these aggressive approaches. There were advances in radiation techniques that occurred through the 90s and early 2000s that changed that paradigm a little bit and allowed radiation to be more of a primary treatment. Now we've learned more about all the disease processes, and we've had more capabilities from a surgical standpoint to mitigate a lot of the effects, that we're able to really work on a case-by-case basis based on the disease site specifically as to whether it's best initially treated with surgery, followed by potentially radiation, potentially followed by nothing and just surgery alone. Alternatively, treated primarily with radiation, potentially with the addition of chemotherapy. So there's a lot of flexibility that, based on the knowledge of these disease processes, we're able to come up with the ideal treatment options for patients, let them know about all of the effects they should be aware of and all of the outcomes we expect, and help them make a good decision for themselves.
Yeah, because there has been, again, this comes from our viewers. There's so much discussion, not necessarily on television, because the television is so, it's 24 hours a day, and they keep on going and talking about almost the same thing all the time, but that's okay. The public's got to know. But the bottom line is that there's been so much advancement in the biological, areas, the DNA and the RNA research that's going on in cancer therapy, that we get a lot of questions from a lot of our seniors that would like to know, well, is that available for me at Broward Health? So what is the answer to them?
For the DNA and precision medicine standpoint, a lot of our medical oncologists are involved in the research, and they do use quite a number of different therapies that will, depending on what the patient is positive or negative for, that is available here. And between the medical oncology and radiation oncology, they do work together to provide the appropriate care for the patient.
The reason I'm glad you said that, because my natural comment to individuals, not necessarily over the television network, but is that we have such a change. With all due respect to all of the veteran clinicians, nurse professionals, hospital organizations, and others that have grown up in our communities of South Florida, we are so much more available for the general citizenry that they don't have to go running off to Texas or New York or whatever. You know the places, I'm not going to mention the names, because we have these services available. Is that true, Pia?
We have them available here, and a lot of times patients want to go away because of different research protocols. We have a very active research program here at Broward Health when it comes to cancer care and cardiovascular care. And so we are able to offer all these services that patients would want to access outside of the state. We are able to offer them here. That is the way it is, and we're right there with any of the other large cancer institutes nationally with bringing research here to our community and for our patients here.
Dr. Sobel, even though we are at this point in time, and when this program will be seen, we'll still be at the time when people are living with the crisis of the pandemic. We don't know yet whether it's going to spike again because of the change in people's habits. But coming from your training at Johns Hopkins, which is sort of the epicenter for data in the United States, I don't want to take you off subject, but I just wondered, how do you feel when you hear that the institute that gave you such knowledge is so forward with data which helps us protect ourselves and stay well?
There's certainly a source of pride that comes from that, but the real relationship with Johns Hopkins is down, just like it is with Broward Health, is its providers. My mentors have been fantastic in helping me along and inspiring me and really guiding me towards the direction that I've taken today. And seeing that same consistent reputation from Johns Hopkins is not surprising. We hope to bring that same level of care here to Broward Health, and currently in just my short few months of being here, we've already been able to make a huge impact.
Well, I'm aware of it. It's just that I wanted it to come from your mouth. I'm not, like I said, I'm just a moderator here. I think it's very important for people to recognize that they don't have to go back to Chicago or New York or wherever. God bless, and it's wonderment. I think it's a terrific thing. And I'm so proud of Broward Health and your friends and colleagues and other institutions that are showing the people of our communities that the finest of healthcare is available right here. Correct?
We are committed to staying at the forefront. Broward Health will be there to care for our community, whether it's cancer care or any other care. Broward Health is committed to staying at the forefront of all of this and bringing the care and to our community here.
Well, thank you, Pia. I know you have a lot of specialty nurse professionals that support the cancer services or the cancer, I guess, surgical teams, not only in the OR, but I'm talking in the care, in the care aftercare as well. So can we talk a bit about that?
Well, we have our oncology certified nurses that are here to do the chemotherapy. These are nurses that are nationally certified in chemotherapy administration and care of the cancer patient. We also have the same oncology certified nurses that are on our inpatient unit, giving care to our patients there also. As a nurse practitioner, I am also involved in the care of cancer patients, whether it is the breast cancer patient, whether it is with doing cancer screenings out in the community and getting education out into the community.
And really the other issue is your involvement in what I would call palliative.
Yes, we do have an active palliative care team that is here to support the patient when they're going through any changes in life situation. And they are very active in our ICUs, in our oncology program, in our trauma program, even in our women's and children's hospital.
Well, that's great. I want to thank both of you. We're down to the last minute and a half of the show, and I think it's very important for the viewers to know that we have services available here. You don't, of course, in today's world, and we're still in the pandemic era right now, and will be for a while, and we don't have to be flying all over the place. You're getting more knowledge as to the healthcare services that are available. I'm very, very pleased and happy and at the success of our cancer services, not only at Broward Health, but generally in the state of Florida, to tell you the truth. And I congratulate you, Pia Delvaille, and Dr. Ryan Sobel. Welcome to our community. I can assure you that people will be very pleased at the capabilities and the services that you provide, and we congratulate you. You're both very strong, knowledgeable people. And Pia, I want to just say something special to you, because I know a bit about you, and to tell you the truth, you are a tremendous advocate. And I always say that advocates are the blessed ones in our community. So thank you for all the years of services. That doesn't mean that you're getting older. It just means that you're getting wiser, you see?
Absolutely. Thank you.
So thank you very much. Dr. Ryan Sobel, thank you. I wish you nothing but the very best, not only for you, but to tell you the truth, more importantly, for your patients. Remember, this program really is your program, and I always tell you, take good care of yourself. So remember, you have people out there that care about you, so I want you to take good care of yourself so that you can get their services. This program is called Dateline Health. We come to you from Nova Southeastern University, and I want you to know that I want you to be good citizens and obey the CDC guidelines if you can. Please, remember, My name is Fred Lippman. We come to you from Nova Southeastern University. Until next time, see ya.